Eddie, I was looking for you. Thank you for joining me today for today's weekly update on a variety of issues. The first issue that I want to address will be the 4 bills that are on my desk from the extended general session of the legislature, and I want to address those specifically. First, I have on my desk SB 739 and House Bill 1977, which are similar bills. Both were passed by wide margins in the General Assembly. The bills, as you know, mandate testing or proof of immunity as an alternative to vaccine requirements. It applies to all employers. It may increase unemployment claims, and it allocates most of the cost of the testing, most likely will fall ultimately on the employee. My objection is, first of all, that this is not appropriate to be considered in an extended general session. But substantively, beyond that, these bills are unnecessary, and the debate on these bills have been harmful to our goal of increasing vaccination rates in Arkansas. For those reasons, I will not sign the bills into law. I will allow them to become law without my signature. And let me explain a little bit more of my thinking on these bills. These 2 bills are designed to push back on President Biden's vaccine mandate for federal contractors and employers with more than 100 employees. Let me emphasize that I disagree with the federal mandate on vaccinations. I'm opposed to the mandate by the Biden administration, but the solution is not to place additional mandates on employers at the state government level. The solution is not to place the employers in a squeeze play between the federal government and state government. Employers need the freedom to protect their employees and their customers, and the government should not interfere with that freedom through mandates. Now, I'm getting some inquiries about an encouragement to sign a Texas-style executive order prohibiting vaccine requirements by any business. That, in my judgment, is contrary to the idea that the private sector should not be overregulated. I do not support that kind of government interference. While some Arkansans state they need to be able to opt out of the vaccine requirements for medical or religious reasons, I want to emphasize that those protections are already in place. Those protections are already in place under current law. In fact, based upon the President's announcement, it is anticipated that the federal mandate will allow for weekly testing for those individuals who do not wish to take the vaccine. And there's already in place medical and religious exemptions for any vaccine requirements in the workplace. Therefore, these bills are unnecessary and could interfere with the employment at will status that exists in the state of Arkansas, and they could be also costly for the employees. I want to also mention another point about these 2 bills. In essence, the debate and the bills themselves create distrust and additional hesitancy regarding the COVID-19 vaccines. These vaccines are safe and have been carefully tested and evaluated. The FDA has a rigorous approval process which the vaccines have passed. The vaccines are safe, and Arkansans need to get vaccinated, but not through mandates and from the state level or from the federal level. Finally, one factor in my decision not to veto the legislation is the fact that the General Assembly defeated the emergency clause. The extra 90 days before the bills go into effect allows critical time to assess the harm and for the courts to review the bills as well if there is any challenge to those pieces of legislation. And so those are the two bills relating to vaccine mandates and testing. And now let me address the two other bills that are on my desk, which relate to the congressional redistricting. As you know, just in terms of background, the United States Constitution gives the Arkansas General Assembly the sole responsibility to formulate the redistricting plans every 10 years. If challenged, judicial branch weighs in, as they have done in the past, and reviews it from a constitutional standpoint. In terms of the bills that are before me that reallocates the population of 4 congressional districts, I am concerned about the impact of the redistricting plan on minority populations. While the percentage of minority populations for 3 of the 4 congressional districts do not differ that much from the current percentages, the removal of minority areas in Pulaski County into 2 different congressional districts does raise concerns. I could go through those statistics, but I will not at this time. I've been contacted by a number of people asking me to veto the legislation. I've decided not to veto the congressional redistricting bills out of deference to the legislative prerogative and the political process, but instead to let them go into law without my signature. This will enable those who wish to challenge the redistricting plan in court to do so. I would add, just as a matter of historical background, in 1990, which is, believe it or not, 30 years ago, I was counsel in a case joining with the NAACP in which we challenged jointly the congressional redistricting plan passed by the General Assembly at that time. While the court in that case determined the map did not violate the dilution section of the Voting Rights Act and the plan did not constitute intentional discrimination, I learned a lot from that experience. And I learned from that experience the real concerns of the minority population about their equal opportunity to have an effective voice in congressional elections. Fair and equal representation is necessary for the integrity and the essence of our democratic process. And so with that, let me move to our case reports before we turn it open for questions today. And I think there are some fascinating aspects about where we are, particularly in vaccinations. And I put it back into the one that is more difficult to see. But if you look at this, on the top section under cases, we have an increase of 694 cases over the last 24 hours, which is down from a week ago, which is very good news. The active cases are down, 104. Our deaths regrettably continue at too high of a level, reflecting the seriousness of the Delta variant, 19 new deaths. On terms of the bottom, the hospital data, you can see we have 6 fewer at the hospital, 3 additional on ventilators, and then the other one I'd want to point out is our vaccination, our doses given. We are at 6,951 doses given out in the last 24 hours. Of those, 50% roughly are booster shots or 3rd doses, and our increase, as you can see, for those fully immunized has gone up 2,000. That's a very slow incremental increase in vaccinations that I would like to see accelerated. And if you go to the next slide, you can see it in a little bit different fashion. And previously, the last month or so, we've been doing just showing, from January on to where we are now. This graph takes us back to the very beginning last March, and it's instructive because of that. So last March, you can see the gradual decline in 2020, where we reached the peak in January of this year, and you can see how high a peak it was. And then you can see how steep a decline it was subsequent to that, where we came down in March and April and May at a very low level in terms of the new cases, and then the Delta variant hit, and we had a very steep incline, very rapid increase. Contrast that to the gradual one that we had last January. And then you can see our decline is a little bit more gradual also versus what the decline was very steeply in January. Again, this reflects the seriousness of the Delta variant, and it will be instructive to us to see how low we will go, whether we can go as low as we did when we didn't have the Delta variant, or whether we're going to have some residual challenges as we go into the latter months of this year. And then let's go to the next one. The active cases, you can see, continue to decline. We're not as low as we were before. Let's go to the next one. I like to emphasize this. I get asked about this a lot. Well, why aren't you telling everybody about those that are getting hospital or new cases, whether they've been vaccinated or not? And that's what we show every week. And you can see the new cases, only 11% of the new cases are those that have been vaccinated, fully vaccinated. Hospitalizations, over 90% of those that are hospitalized have not been fully vaccinated. And the deaths, almost 90% of the deaths are those who have not been fully vaccinated. Clearly, from a statistical standpoint, from our Department of Health, vaccinations make a difference in cases, infections, hospitalizations, and deaths. Next, the 12 plus population, eligible population getting vaccinated continues to go up 64.6%. That's been partially or fully vaccinated. And then you'll see this chart that Dr. Romero wanted to emphasize, we'll have some comments about, and that is the percent of adolescents, which are 12 through 18, that have been immunized. In other words, they've received the vaccination. And the point, when they became eligible, there was such a steep incline, rapid uptake of vaccination among that age group. But now you can see it flattening out at the top level. That obviously is not what we want to see. We want to continue to emphasize the opportunity to be vaccinated for our adolescents. And whenever you look at quarantines at school, the easiest answer for avoiding quarantine at school is to get vaccinated. It's not complicated. And it gives you that protection, gives you that assurance, which helps our teachers out, it helps our education out. We don't want those days missed, but there's one easy solution, and that is the vaccination opportunity. I believe that's, this just shows the positivity rate is below 10%. We hope that it can go lower than that. With that, Dr. Romero, you've been patient, and I know you have some emphasis that you want to provide as well today. Dr. Romero.
Thank you, Governor. To go back to the slide that the Governor presented on uptake of vaccine for 12 to 18 years old, I want to stress the importance of that vaccine to the parents. That vaccine is safe and effective. It is, as the Governor mentioned, it is the easiest way to get out of quarantine in schools if you are infected. Or exposed, excuse me. These vaccines, again, have been shown to be safe. We now have several months of data with them based on top of the previous data. So please, these are available at multiple sites, at pharmacies, doctor's offices, and your local health unit. And if you can't find a site that has it, please call the health department. We will tell you where you can go. In my final comments are dealing with the vaccines that may be coming next month for the 5 to 11-year-old group. I presented data here last week, I believe, showing that we, during the surge, showed a 94% increase in the number of children hospitalized with disease because of that virus. And the largest number of cases occurred, that is the biggest jump of cases occurred, in that 5 to 11-year-old group. So that group will now have, we hope, if the FDA and the ACIP rule in favor of using that vaccine, we'll have that availability next month, and we should be stressing to our parents that that opportunity will be available also at local health units, physicians' offices, and pharmacies to receive that vaccine. So just preparing parents so that they know that's coming. Thank you all very much.
And I did want to recognize Gina Rendell, who is here, Chief of Staff of the Department of Education, and she's available for any questions you might have as well. With that, we'll be glad to take any questions.
On the bills you're allowing to become law, first of all, on redistricting, do you think that could withstand a court challenge given the concerns that you've raised about the impact it has on minority influence? And on the vaccine opt-out, what conversations are you having with federal officials to figure out how this may fit in with the federal rules on the vaccine mandate?
Great question, both of them, of course. In terms of how the court would review the current redistricting plan, I don't know. Obviously, there will be some concerns that will be reviewed in terms of reducing the minority population and splitting some of it from Pulaski County. But if you look at the exact percentages, they're really incremental small shifts of population. And there's still, the minority population is widely dispersed in the 4th District, the 2nd District, and the 1st District. But that was true in the last redistricting plan. So it was just some minor shifts, not minor shifts, significant shifts of what was split out of Pulaski County. That's the greatest concern to me, but I cannot predict what the courts would do as they review that. In terms of the second question, the biggest number of challenges is that we expect rules to come out from the Department of Labor that will guide our employers and our federal contractors. And we have a lot of federal contractors, and they're going to be either following the federal law or trying to follow state law. Obviously, federal law trumps, but you're still putting them in what I described as a squeeze play between two different levels of government. And that's just a position that employers should not be in. One of the areas of conflict is that the state law allows for proof of immunization from natural immunity. Well, that's never been defined by the FDA as to the standards of natural immunity, and so that is not something that I would expect to be in the federal rules that come down. That will be in direct conflict with the state, and then the other one would be in the requirements on testing. I think the state law is much more broad, it's much more flexible, and probably easier to circumvent serious testing than what the federal requirements that I would anticipate being. So those are just a couple of different variations that we'll have to wait to see how that plays out.
Do you think Pulaski County is immune from being divided? Because I guess in some folks' defense, they brought down the number of split counties from 5 to 2.
No, I don't. I mean, we've split counties before. Sebastian County is split. There's other counties that have been split historically. So as I've always said, it's not whether you split Pulaski County or not, it's how you split it and whether you diminish minority voting strength and you have particular harm to that population in the 2nd District. To me, that's the fundamental question that the courts will have to evaluate.
Governor, did you decline to veto these 4 bills because of the likelihood of the legislature overriding that veto?
You know, that's always some factor, but as you know, in some instances in the past, I vetoed it even though I knew that it was going to be overridden. So that's not the governing characteristic. So there's a lot of factors that go into it. As I said, the fact that there was no emergency clause on the second, on the testing bill, on that was a factor in me not vetoing it and saying there's time to see and measure the harm from it. On the congressional redistricting, the issue there is, while I disagree and where I believe I would have done it differently, I wanted to give flexibility to the legislative body that is charged with that responsibility, even though it is a bill that comes to my desk.
The special session on taxes, did that play into your thinking on allowing the bills to become law without your signature as opposed to vetoes?
Help me out again. How's that question different?
The special session on tax cuts,
Oh,
was that a factor in your decision to allow these to become law?
well, I'll put it in the context that I'm always hesitant to veto bills unless that's the absolute necessity and consistent with my convictions, and there's really not any way around that. So, as you know, I've vetoed bills in the past, but you can send a signal of displeasure and by not signing a bill and my own disagreement. And to me, that's important. I disagree with these bills. I would have done it differently, and I believe they were counterproductive in terms of the vaccination bill. But I want to work in a collegial way with the General Assembly. We always try to do that, and so you do not want to veto unless that's absolutely necessary based upon my convictions, and I did not see that here now.
Planning to issue a call?
As soon as we get the votes lined up, the leadership, House and Senate, they're working the tax plan and trying to measure the support for it. And once I'm confident of that, then we'll issue the call. I would expect it will not be this week. I would expect to be sometime next week. And as you know, many times we wait until close to the session to make sure we have all the items that need to be cleaned up on there.
So I'll know those calls coming when I see Hickey and Shepherd next to you?
I'm sorry, what?
I'll know the calls coming when I see Hickey and Shepherd next to you?
That's you'll know that's the start of the beginning.
Concerned are you about push for things other than tax cuts to be attempted? Things like the Texas abortion ban, critical race theory, more vaccine mandate related bills. How big of a concern is that for you? And also, on if there is an attempt to do a Texas style abortion ban, would you sign that if that reached your desk?
Well, in terms of other issues coming before the special session, that's, based upon experience of the extended regular session, is likely to happen. And some members have said they are going to be presenting different ideas. I'm not going to curtail my agenda, the agenda that I think is important to the state, because of that concern. The tax cutting bills are critical and important for our families coming out of the pandemic to have more money in their pockets. Under our rules of procedure, the agenda items that I set forth in a special call has to be considered first, and then after those are completed, they can move on to any other additional items with a high threshold. So we'll just have to work through that. I'm not going to say what I will sign or not sign if it gets to my desk. Let's see what may or may not be offered. Are there any questions remotely? I don't know if we had anybody
Yes.
today.
Good afternoon, Governor. Brett Raines with 4029. Back on COVID-19, we know you've advocated for local school boards and school districts to basically decide their local face mask requirements for students and staff. Yet recently a Benton County judge entered a temporary restraining order against the Bentonville School District, effectively ending their mandate. Is that something you're aware of? And what are your thoughts? That temporary restraining order basically says it appears only the governor through emergency powers and the Department of Health have the power to enact face mask requirements for students.
I am aware of that ruling. I think it was poorly reasoned. I don't believe it is sound. My understanding that the Bentonville School District has voted in terms of their board to appeal that decision, and I think as I've articulated the case here in Pulaski County, it's important for local school districts to have that flexibility in terms of public health and protecting their students, and that's a position I support, particularly whenever the 12 and under cannot be vaccinated. They have to have the capability of taking what measures they need to protect their students and their faculty and to continue school. Next question.
Governor, do you see yourself adding any items to the call beyond the tax cuts?
There are some cleanup items. I won't specify what they are today, but there's a number of items that need to be have technical corrections or some adjustments made. So there will be more than one or two items to the call.
But as far as other topics like an abortion bill or
No, I don't anticipate adding those to the call. And the reason is I'm pro-life. I think I want to follow what's happening in the Texas bill. But we need some guidance from the Supreme Court. I mean, in the next month or so, you're going to have additional guidance from the court system as to what's going to be permissible. We have the most conservative and pro-life bill passed in the country right here in Arkansas now. So let's let these very pro-life bills work through the court system, hopefully to get good definitive rulings and guidance on that. But to me, it's premature at this point to be adding anything like the Texas bill to the call. With that, last question.
Get your take on this. A lot of the Arkansas delegation has come out against the IRS bank monitoring. Didn't know if you had a take on that or what your thoughts are on that.
It doesn't make sense to me. Right now, I mean, of course, I'm as former head of the DA and my law enforcement background, familiar with the currency transaction reports of transactions over $10,000 cash. And that is really designed as a monitoring tool for criminal activity. It appears to me that they're wanting to lower the threshold down to $600 for reporting to IRS for not monitoring criminal activity, but for collection of revenue. I think that would be a burden on our systems. It's over-regulation, and I would not be supportive of that. Thank you very much for your presence today and your interest in this.